This topic is virus in Latin means venom or poison. These are microscopic organisms that multiply and eventually damage. There are mainly two types of viruses based on the nuclear material, either DNA virus or RNA virus. Viral infections can manifest in different types. For example, an acute infection can be an acute infection. For example, polio, a latent infection, which is herpes simplex, a persistent infection in case of HIV, and transformation to a neoplasm in case of HPV. Today, I'm going to discuss about herpes simplex virus. Herpes simplex can cause acute as a common virus disease that affects the man. Herpes simplex viruses are double-stranded DNA virus. So there are two types of herpes virus, HSV1 and HSV2. Both viruses affect the ectodermal tissues, hence known as herpes virus hominis. The ectodermal tissue comprises of skin, mucous membrane, eyes, and CNS. So there are two types of virus, HSV1 and HSV2. The infections caused by HSV1 is the upper half of the body, and HSV2 affects the lower half. Simplex infections are herpes labialis. It's also called as fever, blisters, or cold sores. It is a common viral disease. And the incubation time period of herpes simplex virus is 1 to 26 days. It has two types of infection. It has two types of infection. First one is a primary infection. Next one is a secondary or recurrent infection. Primary infections are in persons who do not have circulating antibodies, whereas secondary infection or recurrent infection is in person who have circulating antibody. It is difficult to differentiate clinically between the primary pathogenesis of the disease. In most of the viral infection, right after initial contact, there is an incubation period of 1 to 2 days. During incubation period, there is viral replication happens, which later follow to a symptomatic stage of primary infection. This is a transmissible stage, usually seen in childhood. 99% of cases are symptomatic, whereas 1% is symptomatic. There won't be any circulating antibody. Like I said before, HSV is a latent infection that is dormant in the sensory ganglia, for example, trigeminal ganglia and sacral ganglia. There won't be viral replication, and this period it's not transmissible. The latency can have a reactivation period. A reactivation can occur several times in the lifetime of the patient. Reactivation causes secondary infection or a recrudescent infection or a recurrent infection. This time period is a seropositive. Means there will be circulating antibodies. As you can see here, the susceptible host who doesn't have antibodies, virus and enter through mucosal surfaces or abraded skin, which causes primary infection. The examples of primary infection, 1% can be clinical diseases. For example, primary gingival stomatitis, primary vulvovaginitis, inoculation of HSV, for example, is herpetic whitlow, herpetic eczema, meningoencephalitis, dissemination of HSV. Or 99% of cases that it is asymptomatic, the person go for a carrier stage, that is 70 to 80% of here the virus remain latent excitants or triggering factors like sunshine, fever, gastrointestinal upset, mechanical trauma, allergy, or stress, it can get reactivated to form secondary or recurrent infection, which comes in the form of fever, blisters, herpes labialis, etc. The first one is a primary herpetic stomatitis infection. The causative organism, like I said, it is HSV. It spreads through droplet spread or contact with the lesion, usually affect children and young adults. Most viral infections have is running before, where patients can have non-specific symptoms. So these non-specific symptoms include fever, irritability, headache, pain in swallowing, regional lymphadenopathy. In few days, there will be intense erythematous and edematous mouth and gingiva, with gingiva showing extreme pain. Something like this, which where the gingiva is extensively erythematous and erythematous of vesicles with that rupture to form shallow intraocular ulcers with the erythematous halo and green. These ulcers coalesce to form larger ulcers and can heal within 7 to 14 days without scarring. So this is the erythematous ulcers formed inside the oral cavity. We can diagnose HSV by obtaining fresh scrapings from the base of the lesion and different stains by using different stains like Chinsa, Wrights, or PAP. And this helps to demonstrate specialized cells, which has undergone balloon degeneration, which is known as Zhang cell. And the test is called as Zhang test. So the specimens are herpetic vesicles, which comprises of epithelial blisters. The infected cells are swollen with pale eosinophilic cytoplasm, large vesicular nuclei showing balloon degeneration. Such infected cells are called as Zhang cells. They have intranuclear inclusions, which is called as Lipschutz body. Lipschutz bodies are eosinophilic ovoid homogeneous structure, which is present inside the nucleus that displays the nuclear matter and nuclear chromatin peripherally. So displacement of chromatin gives a peri-inclusion halo. As you can see here, this is the nucleus of the cell which has undergone balloon degeneration. You can see margination of the nuclear matter towards the periphery of the nuclear membrane, and it has eosinophilic homogeneous material, which we call it as Lipschutz body. Cytoplasm of infected cells can form giant cells, and surrounding it gets numerous inflammatory infiltrate. And other primary infections are herpes genitalis, which is a common disease of genitalia. The causative virus is HSV2. Herpetic meningoencephalitis is a serious and bad disease, which is a serious form of herpes infection. Another form of primary infection is the herpetic conjunctivitis or keratoconjunctivitis. Such lesions usually heal rapidly, which is characterized by swelling and congestion of palpebral conjunctiva and vesicles in the eyelids. Another lesion is herpetic eczema, which is also called as kyphosis by ciliform eruption. Usually, it's a serious vesicular lesions on the skin, which is superimposing pre-existing eczemas, which is characterized by diffuse vesicular lesions, which is serious in nature. Another disease is the disseminated herpes. Newborns have infection during passage to the passage through the birth canal of the mother. This condition usually disease manifests by 4th to 7th day of the life of the child, and usually the child die by 9th to 12th day. Another one is herpetitis, which is caused by autoinactivation of herpes virus on the fingers. Next stage is the virus stage, the viral infection in which the viral genome is non-replicating stage in the cell but can become active independently. HSV reaches nerve ganglia supplying the infected area. The nerve ganglia for HSV1 is trigeminal ganglia, and for HSV2 it is lumbosacral ganglia. Recurrent or secondary herpetic infections occur once introduced into the body. It resides commonly in the regional ganglia, and when reactivation is triggered by excitants, it spreads along the nerves to the oral mucosa and skin, where they destroy the epithelial cells, induce lesions of the recurrent infections. The lesions widely in varying intervals arise in varying interval every month or once in a year. Every month or once in a year, it develops in the primary site or along the course of the nerve. There are a lot of triggering factors like old age, pregnancy, sun exposure, GI upset, and menstruation, systemic disease, stress, malignancy, etc. Initial symptoms or prodromal symptoms include initial burning, tingling sensation followed by vesicles on the lip or intraoral site. These are the vesicles on the lip or intraoral site. The vesicles are very small, 1 millimeter or less in number. It occurs in clusters, later coalesce to form larger lesions. The vesicles rupture to form ulcers with brownish crust. Intraorally, lesions develop in the masticatory mucosa. Histopathologically, we can take scraping, fresh scraping of the vesicle. Usually, we have intraepithelial vesicle formation. HSV infected epithelial cells show acantholysis, nuclear clearing, nuclear enlargement, and ballooning degeneration. We can see these are the features seen in the sand cells and lymph body. Epithelial cells sometimes used to form multinucleated giant cells. Virus can be, with the help of diagnosis, virus can be with the help of cell culture, virus can be isolated. Other techniques are immunofluorescence, immunoperoxidase techniques, serological assays like complement fixation, radioimmunoassay, and ANISA can be done. Next is measles. Measles is an acute contagious viral infection caused by paramyxoviridae under the genus of morbillivirus. It is a single-stranded RNA virus. By English, it is also called as English measles, which means spot on the skin, rubeola, which is red, morbilli, or illness. The mode of spread of measles is the droplet spread and direct contact. Incubation period is 10 to 12 days. The infected persons secrete have virus in their nasal secretion and airborne transmission. Healthy people, which is taken up by the or which comes in contact with the healthy people through inhalation. The virus attaches to the primary site of respiratory epithelium of the nasopharynx. Within 2 to 3 days, the virus multiply, replicate, and invade the regional lymph node. From there, they are disseminated to the blood, causing primary viremia, which leads to subsequent infection of reticuloendothelial system. from reticuloendothelial system. Within 5 to 7 days, it causes secondary viremia that attacks the skin, viscera, kidney, and also the virus replicates within the lymphoid tissue. The attack of lungs, which causes nasal secretion. The virus has 3 stages of infection, or measles can be seen in 3 stages. First, hence it is called as a 9-day measles. Each stage has 3 days. The first stage is the prodromal stage. There will be stepwise increase in the fever. It's stepwise increase to fever 103 to 105 Fahrenheit. And you can see 3 C's, or 3 characteristic symptoms. That is cough, coryza, and conjunctivitis. And usually there will be increased lymphadenopathy and swollen tonsils. The characteristic features seen during the infection or 9-day measles is the immune reaction of virus in the endothelial cells, which causes mucosal erythema. You can see small blue-white markings with oblique spots. 97% shows oblique spots, which represent epithelial necrosis due to the virus attacking endothelial blood cells, endothelial blood vessels, which appears to be like grayish grains of salt. As you can see here, these are white markings with bright margins, or mucosal erythema showing destruction of endothelial cells that lead to epithelial necrosis. It is also called as grains of salt. Second stage is a 3-day stage. Again, the fever continues, the complex spots fade, the child can have multiform rashes, which are tiny red markings and irregular lesions. They blanch upon pressure, and they also cause abdominal pain. Third stage is a 3-day measles. Here the fever ends, rashes fade, downward progression, and brown pigmentary staining can be seen. There is only 5-day desquamation without any scarring. The complications of measles can be seen in different people, especially when they are immunocompromised or malnourished. It is usually otitis media, pneumonia, acute appendicitis, acute pancreatitis. Some situations can lead to high risk of mortality. Oral cavity, you can see candidiasis, necrotizing ulcerative gingivitis, enamel hypoplasia, etc. In pregnancy, it can cause high maternal morbidity and mortality. The causative reason is pneumonia in children, and there is an increased perinatal mortality. Serodiagnosis can be done in acute stage of disease. IgM can be done, and in immunity, it is IgG. The virus isolation and culture can be done, and the confirmatory diagnosis is RT-PCR. Histopathological finding is that lymphoid hypoplasia can be seen in prodromal stage, and giant cells are common here with multinucleated giant cells, specifically known as Warthin-Finkelday giant cell. The treatment for this disease, the treatment is not necessarily required in common population. Usually, it's a self-limiting disease which can provide lifetime immunity to the host. And preventive measures like MMR vaccine can be given, which is the full form of MMR vaccine is mumps, measles, rubella vaccine, can be given. Usually it is given at the 9 months age, and second dose by 15 to 18 months. This completes the lecture. Thank you.